Hey everybody, welcome. It's Tracy with Downward Dog Rising, and I'm here to give you a workout that's going to help you if you have osteoporosis or if you have herniated discs in your low back. This can help release your spine a little bit, decompress it, and also strengthen it, as well as strengthen your core, which is going to give you some support for your back. We're not going to do a very long workout, just want to give you some spinal stabilization, core activation, and a couple of stretches. Okay, so let's start. We're going to start off lying down on our back. So you're just going to come to your mat. You're on your back. Your head lengthens away from your tailbone. And then you want to feel like your shoulders, hips, knees, ankles, you're in the same plane of alignment. So your hips aren't to one side of the mat, your shoulders aren't to the other. You're just straight down the center. And then I want you to think of your abdominals have to pull really tight into your back. And then I want you to tilt your pelvis, your hip bones backwards. So when you go to tilt your hip bones backwards, you want to make sure that you're not forcing your low back in the mat. You pull in here, and by pulling in, you slowly pull the abdominal wall through the body into the low back. So you exhale as you do that, and then you just inhale, and then you release. And then it's called a pelvic tilt. Feel how the front of the hip opens a little bit when you tilt your pelvis back. And then you inhale. You can let your abdominals go a little bit when you do that. And then you have to scoop your core. Abdominal wall draws into the length of your spine. And then you inhale, release, and then you exhale. Imagine you're on all fours. This is cat. You'd be rounding tailbone to the ground. Here we're just lengthening, imprinting. Feel open space in your hip joint. And then you inhale as you do a small little arch away from the mat because you're not loading with weight. You're just letting your back stretch forward off the mat. Do like 4 more. Exhale, use your core. Inhale, let your back lift up. Exhale, use your core. 3. And then 2. Find neutral in between your 2 tilts. Okay, so now you have neutral. Your 2 hip bones are straight across, level with each other. So what I want you to do now is really tighten the core. You're going to lift your knee. And then actually, let's just do like an inch off the mat. And then you really feel the 2 hip bones pull tight across. So without moving your pelvis, just exhale, lift your foot up. Inhale down. 9 more, same side, lift. So making sure that your pelvis doesn't rock when you do that. 8, 7, 6, tighten core to back. 5, 4, just float your foot off the floor. 3, 2, 2 hip bones come together. Last one. Switch sides. Exhale. Inhale. Now exhale. Your foot lifts up as your 2 hip bones tighten across. 8 and 7. Inhale. Exhale. Really pull tight. 6, 5. Whenever you tighten your core, your low back naturally drops into the mat. You're not forcing it. 3, 2. Last one. All right. Next thing that I want you to do is actually tighten your core in. Your abdominals pull all the way into the front of the spine, and then back of the spine, front of the spine, I should say, interior. The back of the spine is the posterior where your back is. I'm just moving my yoga mat so I can do a heel slide. Okay, heel slides are going to, your hip bones roll back. You scoop into your center. Now I want to create a little space in the front of your hip, and I want your psoas, the true hip flexor, to do the job of stretching the leg out, pulling the leg in. So right now you're going to feel the low back is lengthening into the mat. And you're just going to go like this. You're going to have your heel slide away, and then you're going to bring it in. I might have to move. I don't have space. I'm kicking things when I don't have space. So now you roll back, and then you slide your heel away. You exhale. And if you went too far, this is what happens. Your spine arcs off the mat. So make sure you imprint, you stay imprinted. Avoid going like that where your hip bones roll forward. And just slide, exhale, come back. Ribs expand, tighten your core. Heel slides out, exhale, come back in. Inhale out, exhale, come back in. Really feel the core deep into your spine and get those abdominals to activate. And 4, inhale. Your back is imprinted in the mat. 3, exhale, pull back in. And 2, inhale, exhale. Last one. All right. So then switch legs. I'm going to switch sides just because I think I could have space to move my leg. So once again, I'm just going to move this out of the way so I have space to slide. And then again, what I want you to do is, okay, you tighten your core. It reaches from front to back body. Scoop your core tight. And then you're going to inhale as your heel slides out. Make sure you avoid lifting or arcing your back off mat. Exhale, come back. Breathe in. Now exhale, come back. Inhale. Exhale. Inhale. Exhale. 4. Abdominals tighten into back. 3. So make sure it's just the leg that moves. Your hips and pelvis are stable on mat 2. Last one, inhale, exhale. All right. Okay, so next, just take your knees, hug them in for a second, and just let your back really release down into the mat. And just breathe. So you're just taking deep inhales, deep exhales into your low back. Inhale, and then you exhale. Breathing in, breathing out. One more time. All right. Next, you might have to move your mat. If you did what I did, slide so that your feet wouldn't get all bunched up on your mat. Okay, next. Okay, we're going to do a bridge. So when you do your bridge, you're making sure you don't arch the low back. So if you're doing cat-cow on all fours, you keep the length through the whole low back area. So it's going to look like this. So you roll back, you lift up, you're in between the two tilts. That's your neutral, hips to sky. So now without putting weight in your neck, you just lift straight up. So feel length through those ribs. There's no weight in the neck. Your glutes are engaged. Your inner thighs draw together. And then you're going to go down. Here's your hinge. Go straight to the mat. Without letting your hips roll forward or back, you exhale, you lift up. And then you lower down. And then you lift up. It's finally starting to cool off in here. Ooh, it's hot in here. I don't have my window open, but I will open it before I go to bed just to air out, and then I'll close it again. You lift up, and then you lower down. So you feel how tailbone's long. You're trying to really press those hip bones away from you. Create the elongation in your low back. You're stabilizing your spine, and then your hips go straight down. 3 more. So you just go straight up, straight down. 2 more. You really have to tighten your core like crazy. Your glutes are engaged. Last one. Exhale to lift. Inhale to come back down. Excellent. Okay, so next thing that I'm going to ask you to do, you did a pelvic tilt, which is a pelvic clock, 12 o'clock, 6 o'clock. This is 12. This is 6, face of a clock. Okay, your 2 hip bones So you're going to have your 3 o'clock is the right hip. You're going to have your 9 o'clock is the left hip. Now, make a straight line across your 2 hip bones. You could even place your thumbs at the bottom of each rib cage, and then you could place your fingertips where these hip bones, those 2 hip bones, make a space here between rib cage and hip bones. And you make sure that the space on each side, you don't let your fingers and thumbs hit together. You keep the space open. And then imagine you have a marble here, or you're sloshing water from this side of the pelvis across. So without letting this gap close together, without pinching, without letting your hip hike up, you would just lift one side and use your obliques. So go to the side of your navel, pull these muscles down to bring your hip to the mat. So you connect from the front of the body to the back of the body, and you engage, pull from front to back body. You're going to feel the side of your spine stretch. Lift the hip up, lower the hip down without closing out your gap. You go up, straight line from hip bone to hip bone, then you come down. 4, the hip goes up, the hip goes down. 3, the hip goes up, the hip goes down. 2. So it's better, the least amount that your legs move, the better. Last one, the pelvis moves, the legs do not. You keep tightening, hip bones across. And again, go to the bottom of the ribs, go to where the hip bones start. Now you lift up your opposite hip, pull it down. We usually have one side a little harder to control. So go to the right of your navel. When 3 o'clock goes up, pull back into the mat. So you have to keep the space open. The hip goes up, the hip goes down. Create, pull from front to back body to bring your hip down. Inhale, exhale. Inhale, exhale. The hip goes up, the hip goes down. The hip goes up, the hip goes down. 2 more. Up and down. Feel that side of the spine open up like a little spring. And then gently come in. So it's mental work. It's a lot of mental work. And then just hug those knees in for a moment. Release the pressure off your spine. Just let that whole back area release for a sec. Inhale. And then exhale. And then inhale. And exhale. And one more time. You're going to inhale. And then you're going to exhale. Awesome. Okay. Next. I want you to do half happy baby from yoga. Ardha Ananda Balasana. So you're going to extend this right leg out straight. And then you're going to reach to the pinky toe side. And you're just going to start to drop the knee. Make a straight line from knee to ankle. And then you pull that arm to the side. And then your knee goes out. You're going to feel a little crease in the hip. I'm not going to ask you to do this if you've had a hip replacement, just because of putting pressure on the prosthetic hip. So avoid if you've had a hip replacement. And then you would just stay here and breathe. Feel the front of one hip open. Feel the crease in this hip. So you're just trying to get that thigh to drop deeper down into the socket. You inhale. You exhale. Feel the entire spine lengthen. Feel the release in your hip. It'll open the hip. Breathe in. Breathe out. Breathe in. Breathe out. And one more time. You're going to breathe in. Breathe out. Excellent. From Ardha Ananda Balasana, happy baby, you're going to go into Ardha. Never mind. It's not Ardha. Just tree pose is Vrikshasana. So you would take your foot, and then your foot is either, I'm going to slide back, it's going to go, the bottom of your foot either goes above or below the knee, but not on the knee. And then we do this standing, but for now, I want you to do this lying on the ground. So you're going to extend this right leg straight to your mat. And you're going to bring the sole, the bottom of your foot, the inside of your thigh. And then you're just going to let this knee drop out to the side. So your 2 hip bones should be facing the sky. This knee should face straight to the sky. Your hips are squared. And then you're just going to reach your palms to the sky, open your heart, and breathe. So you're just breathing in, breathing out. So I'm trying to let gravity pull this hip down deeper. I'm trying to open up that hip a little bit. Tailbone's long. You're tightening your core in. Relax your shoulders. So you're just going to inhale. Think of that tailbone lengthening away. Exhale. And you breathe in. And exhale. 3 more times. Breathing in. Exhale. And 1 more time. Deep inhale. And deep exhale. Wonderful. So now you're just going to take this leg and just do small little knee sway side to side. Feel a little space here between rib cage, hip bones. And then you're going to take this left leg all the way down to the mat. Then you're going to take the bottom of this right foot and just let it sway sideways like a tree. I'm just going to flip around real quick. All right, coming back to the mat. Take your left leg straight and then take your right bottom of your foot to this inside of the foot. And then you just drop your leg to the side, making sure the 2 hips still face straight above you because you're not twisting your pelvis off the mat. And then you're just going to have your palms face up in the air. Chest is open, kneecap, straight leg kneecap faces up. And you're trying to create the length between the rib cage and the hip bones. Stay here and breathe. Breathing in. Breathing out. Breathing in. And breathing out. Soften your jaw. Soften the mouth. Even soften your eye gaze. Feel lengthened spine, breathing in and breathing out. Feel how this right hip opens. The front of the left hip flexor. This thigh bone is rotating. So if you have impingement in the hip and it puts pressure on a nerve or in the spine, like we're letting this leg bone twist externally deeper into your hip socket. So hopefully you can let that hip open a little more. Inhale, exhale. Feel how collarbones widen, shoulders relax down into the mat. Inhale, exhale. 1 more deep inhale here. Exhale, gently release. All right. So now you're just going to bring this leg back up. And then this next exercise, let me just slide this back a little. All right, so this next exercise, I'm coming back down. All right. This is one that's going to help you knee sway. So when we do a knee sway, we want pelvic stability. We don't want you to go like that and then have both hip bones roll sideways. So again, shoulders, hips, knees, ankles, everything's in alignment. And then what you do, you have to really activate transversus abdominis, horizontal muscle fiber like it's pulling a belt tight across. And then feel how your spine's reaching long against the mat. So this next one, you pull the 2 hip points together. You feel the spine's long on the mat. You tighten abdominal wall into the length of the spine. And then you just gently start to let your knee drop to the side. And then you have to exhale, bring the leg up, keep hip bones facing the sky. You inhale, and then you feel like the 2 sides of the ribs pull together. If you've gone too far, it would destabilize your pelvis and you'd have like your legs fall over. We don't want that. So it's different than in yoga if we twist our spine. Here we do not want to twist our spine at all. Hip points come together. You let your knee start to reach to the side. Inhale. And then really deep exhale, wrap hip points together. That low back is dropping all by itself into the mat now. You don't have to push it. Inhale, and then you exhale, come back. Inhale, side. Exhale, come back. Feel both sides of your low back lengthen. Inhale, exhale, back. Inhale, ribs expand. Hip bones stay to the sky. Your core tightens to your spine. Exhale, back. 5. You might even feel length on each side of the spine. If your quadratus lumborum is hiked up, you might feel half of the spine lengthening right now. 2 more. Last one. Hips to sky. Careful not to move your pelvis. Exhale. Again, your hips are straight. Your ribs pull around. The middle part of the back has elongated enough. It dropped into the mat. Other side. Sometimes one side's weaker. Work those obliques. They wrap around to the center. Inhale. Let your knee go to the side. Exhale. Inhale. Hips to sky. Really feel the sides of your ribs wrap. Exhale. Inhale. Avoid moving those hip bones. Exhale. 6 more. The leg sways wherever it can. Pull it back in. 5. Those 2 hip points come across together. Exhale. 4. Exhale. 3. 2 more. Hips to sky. Tighten the core. And last one. All right. Now from here, you're going to take right leg straight. Hug knee to chest. Reach under the knee. Pull that leg in. Just let your low back really sink against the mat. Inhale, exhale. And inhale, exhale. Let that low back release. Inhale, exhale. And switch. So you just take that leg down. Bring the other knee to your chest. Hug in. Low back is long into that. You inhale. And then you exhale. You inhale. And then you exhale. 2 more times. Inhale. And exhale. And one more time. You're going to inhale. And then exhale. Awesome. All right. I'm going to give 2 alternatives because sometimes if you have back pain, you can't actually lie on your stomach. It's like impossible because you have too much pain. And the minute you lie on your stomach, your back arches and it loads, and so you're back to where you started. If you're okay and you can roll onto your abdominals, this one's for you. If you're not okay, so I'll show you what I mean. If you're not okay, this might be too much for you. So if you slide down to your mat, the feet, your knees, your ankles, everything are like together. And then what happens, so you might not be able to see everything the way this camera is today. Let's see. What I'm going to ask you to do is you lie down, your arms stretch overhead. So then I might have to push this back to get a fuller shot. Sometimes I can't talk anymore. I'm just done. Okay. So now you come to the mat. You're going to extend your arms straight over your head. Make sure you don't hunch your shoulders up. And then you're going to do your opposite arm and your opposite leg. Float off the mat. And work on length. Let me show you what length is. If you lift your leg off the mat, that's length. You stretch long. You're not going way up there because that could compress your spine. So this is length. You just lengthen behind you, set the leg down, and then you lengthen behind you without moving the pelvis. So your hip points forward on the mat. You lift opposite arm, opposite leg, and then you lower down. You lift the opposite arm, the opposite leg, and then you lower down. This is good if you have osteoporosis as well as herniated discs. Stretch part, come in. Stretch part. If you have spinal stenosis, you're going to keep this whole part lengthening, 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 protected. We definitely do not want the low back to squish together like that and to arch off the mat. We do not want that. Spinal stenosis, keep this lengthened, keep it in neutral. And then what I want you to do, opposite arm, opposite leg, lift up, lower down, and then opposite sides, arm and leg, lift up, lower down, opposite arm and leg, scoop your core really tight, lower down, opposite arm and leg, and lower down, one at a time. Inhale, exhale. Your abdominal wall tightens in like crazy into your low back. And 5. Use your core. 4. Now, if this was too painful to lay on your stomach, by all means, you're not going to lay on your stomach. You would do all 4 position like this, bird dog. You would like spread your shoulder blades apart, lift your abdominals in, and then you would do opposite arm and leg. Come in. Stay on the same opposite 2 sides. It's easier, I think. So you just do all of them. Right arm, left leg, 3. Come in, and 2. Come in, last 1. Switch. Make sure those 2 hip bones come across tight together. Opposite arm and leg, you would lift. Make sure hips do not move. Stretch apart. Come down. Stretch apart. Come down. Stretch apart. Come down. Tighten core in. And 2. Opposite arm and leg. Stretch apart. And down. Last 1. Stretch apart. And down. Good job. All right. Now, if that was too much, you would take it down a notch even more. Opposite arm goes up, comes down. Shoulder blade anchors down back. Scoop your core really tight to your spine. Opposite arm, come in. Opposite arm, come in. Opposite arm, anchor the blade down your back. Good. 4. Tighten your 2 hip bones straight together. Keep back in neutral. And 3. Exhale. And 2. Exhale. Last 1. Breathe in, breathe out. Okay, say arms and legs was just too much for you. Then you would just do legs. So then you would have your leg reach back, elevate to the height of your hip and glute, tap and lift. Tighten your core to your spine. You shouldn't be moving the pelvis at all. Really scoop your core tight so it looks like that, just to hip height. And down, tighten core. And 7, tighten core to spine. 6, shoulder blades down your back, scoop in. And 5, use your core. 4 more, scoop your core really tight. 3 more, 2 more, last 1. All right, you're gonna switch now. You're gonna do the opposite leg, so tailbone reaches long, shoulders out of ear, so sides and neck are long. Now you just keep those 2 hip points drawing together. Now you just take your leg out, and then you don't want to go too high, just to hip height. You engage your glute, you scoop your core tight, you lift, and then you lower. So you just go exhale, lift, squeeze your glute, tighten your core. 8 and 7, so we're just breaking everything down. 6, use your core. And 5, 4 more, and 3, 2 more. Your core tightens to your back. Last 1. All right, and then we're just gonna gently, we're gonna come forward. Actually, we're gonna go straight back for a second, come to the forearms. Now see if it's okay to just go all the way to your mat, protecting your back. Okay, next thing, I just want you to see if you can take your hands to the sides, and then I want you to feel like this part really stretches long. Remember, avoid this kind of motion. Look at how it makes a space. It makes like a divot into my low back. That will load up too much there and bother you later. So avoid that kind of motion. Think tailbone long, abdominal wall lifts off the mat to your spine. And then what I want you to do is bring your hands a little bit to the sides of your body. And I want you to just tighten the core in, float up, and then come back down. Keep your hips firm on mat, and we're not even letting our ribs lift off the mat for this one. I want you to stay in your thoracic spine. So you're going to tighten your core, lengthen your tailbone away from you, and then just slowly lower back down. Use your core. Exhale. We want to get your middle back to have some space. Exhale and inhale. And I'm actually using an exhale to lift you up because I'm giving you stabilization for low back. Inhale helps you higher, go higher, but I don't really want you to go too high right now. So you're just going to exhale, scoop your core tight, keep chin slightly towards front of neck, so neck is long. And then just do a few more. Exhale, chest is wide open, collarbones wide. And 3, exhale. Tighten your core in. 2 more, so you're just getting that mid back strong. And last one, inhale. And then exhale, chest is open. All right. Now slowly from here, well, let's just relax our forehead and the backs of our hands. And we're just going to release side to side, stretch the sides of your neck. Just nod head no. All right. Gently release. Okay, you're going to take your hands under your shoulders. Press up, tighten your core. Press to your hands and your knees. And then I do want you to go back into a little rest pose. And then if you have knee issues, take a folded up yoga blanket, a folded up regular blanket, a pillow, a towel, whatever you want, put it under your knees. And if that was still too much for you, maybe you would just like stick a block back to hold some weight, and then you could even go like this. You could even raise the block if you wanted to stay a little higher, and then you would just have a little support, if I could find the block. So you could sit like with it elevating your hips up to release some pressure off the knees. And then if that was too much, then avoid doing anything that would hurt the knees. You would pull your breastbone forward, and then you would reach your sits bones out behind you. And then you would just breathe in, breathe out. And then if this was too much, you could always go like that. Curl the toes under. And then if you had something higher up, let me see if I could sit on a block, like without making it fall over there. So if you had like a little cushion, you could take some of the weight off the knees, put it through your toes, and hip hinge forward, and just get that back to pull apart 2 different directions. So you're not rounding your back, you're just hip hinged. That's if you can't go all the way to the mat. If you can go all the way to the mat, you would just hinge back. You could curl toes under, pull your sternum through, breathe, breathe, breathe. Inhale, exhale. This might be too much. On your back, feel the crease in your hips. Inhale, exhale. Breathe. Feel space between your shoulder blades. So the upper back between the shoulder blades is not rounded, so it's lengthened. Inhale, exhale. One more time. You're going to inhale and then exhale. Wonderful. Slide the hands in under the shoulders, and then we're just going to end with a little lateral flexion for our spine. So if you're on all fours, hands and knees, and then you would just inhale as your hip and your your hip and your shoulder come closer together on one side, and then you stretch your head away from your tailbone, and then you do shoulder, hip, closer one side, return center to the side. Hips are facing straight down, squared. Inhale, exhale, side bend. Inhale, exhale, side bend. So one side of the ribs is stretching while the other side, the shoulder and the hip come closer in. All right, and now we're going to end. So this concludes our little workout for the spinal stability. If you have a yoga block, you can always come up like that and free the space here right in the front of the hips. You can notice that if I have space, because I lift up my pelvis, you can notice how my knees just naturally drop to the sides. So you could just sit like that and keep the length here through the sides of your rib cage, the sides of your waist, sit tall. So that's an option. And then you would just take a deep inhale. And then exhale. And just notice how shoulders drop away from the ears. You just take a deep inhale and a deep exhale. And that's it. We are done. Breathing in. Exhale. Bring hands to heart. Feeling grateful and thankful that you just did a workout to help your back pain. Whether you have osteoporosis or back pain, this will help strengthen your core and your spine. All right, thanks for joining, everyone. So appreciate you. If you like my channel, please hit like, share, subscribe. I'd greatly appreciate it. Thank you. All right, see you soon. Take care. Peace. Bye.